Matt? Yep. You up?
Yep. No. They're coming. You're in.
There's a whole history. Really? There was a reason and I had looked it up at the beginning of the administration. It always got why did you call it Great Series?
Yeah, maybe that was it.
That is a great story.
Is it hot? During whatever Q&A there may be.
Okay, guys, this time we should really find out. Sure, Tim.
Matt, you talking to the shop? Oh, can I now? You're so benevolent. How does that go again? What that says on? I'll work it out during the press conference.
guys. Thanks. Yeah, sure. So as you all know, we have made combating the opioid epidemic a primary focus of our administration in the final year. You know the statistics by now, and you know how challenging the fight is not only here in New Jersey but across the entire country. We're losing thousands of people every month to addiction across America. I'm encouraged, though, now that there's nationwide attention that's focused on the effort to eliminate the stigma of addiction and address it like the disease that it is. And I'm proud to say that here in New Jersey, we have tried to set the tone for this discussion throughout the country. Our administration is committed to not only historic funding for this effort, but also a comprehensive, robust, and coordinated approach to providing programs and support for addiction prevention, treatment, and recovery. Last month, we announced that we'd be committing approximately $200 million to implement and expand 25 groundbreaking programs that aid the diverse population that suffers from addiction, including new and expectant mothers, high school and college students, those in need of housing, parents struggling to keep their families together, and individuals who are reentering society from incarceration. One thing we know for sure about this disease is that it does not discriminate, so we need a multifaceted approach because everyone in our state is potentially affected. While developing these initiatives, we relied heavily on the work of the Drug Abuse Control Task Force, which was led by Charlie McKenna and comprised of several members of my cabinet, all of whom head up departments that have a significant role to play in combating this epidemic. When I announced the formation of the task force in my State of the State speech, I charged it with spearheading a multi-pronged, multi-agency attack on the addiction crisis, and that is exactly what it's done. I also told you that at that time that as the chair of the task force, Charlie McKenna would use his vast experience in government to help to bring solutions to the fore to be considered to deal with the crisis that we're facing. And he and the task force have done just that. Today, I'm proud to formally receive and release the report of the Drug Abuse Control Task Force. This report contains 40 recommendations that touch on education, prevention, intervention, treatment, recovery, and reentry. The work of the task force has already inspired several groundbreaking initiatives, many of which I rolled out this past month. Going forward, it will serve as a blueprint for further work that needs to be done both in New Jersey and across the nation. I want to thank the task force for their thoughtful, thorough, and practical report. I appreciate the work that went into studying the issue from many different angles. All my cabinet members that served on this task force brought a unique perspective and an experience to the development of these recommendations. I want to thank all of them, and many of them are here today, for committing their time and attention to this issue. For all the individuals that met with the task force members and offered your insight into this issue from a professional or a personal point of view, and sometimes both, I join the task force in thanking you for your help with this report, as well as for everything you do to combat the opioid crisis on a daily basis. And I want to thank my friend Charlie McKenna for agreeing to take on this additional role while also continuing to serve the children of our state by running an effective, efficient, and active school development authority. Charlie's leadership and working with this group on the task force is apparent in every recommendation. Today, I'm directing my staff and cabinet to thoroughly review all the recommendations in the report and develop plans to implement all those that apply to their individual departments before we depart from Trenton on January 16th. Further, I'm pleased to announce the immediate implementation of one of the most important recommendations in the report. It's widely known that naloxone, or Narcan, can save lives when properly deployed to someone experiencing an overdose. First responders have reported to us that 4 milligrams of Narcan is needed to counteract the effects of fentanyl, which is becoming more and more prevalent and is stronger than normal opioids. Although civilians can obtain 4 milligram doses of Narcan, shockingly, not all EMTs are permitted to use more than 2 milligram doses of Narcan. The task force recognized the need for a change, and I fully agree. So today I'm announcing that the Department of Health will be revising all EMT guidelines to permit our first responders to carry 4 milligram doses of Narcan so that they can save even more lives and help those suffering from addiction take the first step towards treatment and recovery, even if the drug that has caused them to overdose is fentanyl. I'm also happy to announce several other recommendations that are already being implemented. The only way to immediately multiply our addiction workforce is to get primary care physicians involved in screening and facilitating treatment for those who need it. The screening, brief intervention, and referral to treatment program trains primary care doctors to screen for substance use in their patients, and then determine how to appropriately treat the patients or refer them to other physicians where appropriate. Data shows that this program is an effective tool to reduce substance use and treat addiction in the early stages. The task force has recommended utilizing this program for young people and adults through their primary care providers. Although federal funding for our program in New Jersey has run out, as part of the package of initiatives I rolled out last month, we are now providing an additional $2 million to ensure that this evidence-based program continues. For young people, we have a similar program, the Child Mental Health Collaborative, which I expanded statewide in fiscal year 18. This program not only trains pediatricians to screen for behavioral health conditions, including substance use, but also provides a central hub with a psychiatrist on call for either consultation or referral. Infants born already addicted to substances are one of the most tragic casualties of the crisis. The task force recognizes this in its recommendations, and they have several ways they want to address this, including a pending RFP for residential treatment for pregnant women and new mothers, supportive housing opportunities for families with young children involved in the child welfare system, peer support professionals to work with parents who are already in treatment and recovery, and training for child protection and permanency staff on substance use disorders and working with these parents towards long-term recovery and family stability. The task force includes two specific recommendations that are already underway in the Department of Children and Families. One is a regulation change that would require healthcare facilities to report instances of substance-exposed infants. This regulation has been proposed and is currently in the public comment process. The other is the development of policies and procedures to work with these infants and families and develop plans of safe care, which DCF is in the final stages of developing. The task force has recommended that we expand statewide one of the most important and successful programs in our state, our Recovery Coach program. Proud to say that not only are we expanding the Recovery Coach program to all 21 counties, we are also expanding the program's scope as part of the $200 million in recovery initiatives we rolled out last month. In addition to meeting people in the emergency rooms following an overdose, state-funded Recovery Coach programs will now have coaches working with individuals post-treatment and post-incarceration. A number of initiatives I announced last month will increase access to medication-assisted treatment. These initiatives include increased access to the full continuum of care with a medical home pilot program, grants to county jails to increase their MAT offerings to inmates, and funding for additional doses of medications prior to release for the Department of Corrections. Their populations that have opioid use disorder will now get these universally. And for DOC releases, we are implementing a program through which patient navigators will ensure these former inmates get immediately connected to services to continue the MAT they were receiving while incarcerated and to also get counseling treatment. Given the increase in drug overdose deaths, including alarming increases in deaths from the new kind of synthetic opioids like fentanyl, it has become clear that our medical examiner's office needed additional resources and new approaches to combat this growing problem. So as a result, part of the initiatives I announced last month, the Office of the Medical Examiner is being provided additional funding to hire staff, upgrade equipment, and outsource certain toxicology reporting. These initiatives will allow for faster, more accurate data to inform law enforcement and state partners about the dangerous substances that are killing our citizens. The task force points out that all medical professionals need ongoing education and training in opioid prescription, pain management, and recognizing the signs of substance use disorder, which is a topic on which we've been very vocal about as well. Accordingly, pursuant to legislation I signed earlier this year, the Division of Consumer Affairs is reviewing and making changes to continuing education requirements for prescribers, and that was part of the budget. In the rollout last month, we made available up to $2 million to the Division of Consumer Affairs for these efforts, and I thank the Attorney General for his support in that regard. Finally, the task force recommends a partnership between the Department of Corrections and community treatment options. While some of that is underway with the connection of inmates to Medicaid and the interim managing entity, the crux of the Patient Navigator program, which I announced last month, will be hands-on support for the recently released inmates with substance use disorders to ensure that they're getting their health care needs and their treatment needs met. We can't have significant reentry and successful reentry if we have people reenter who immediately fall victim to their substance use disorder. They won't be able to be employed, they won't be able to get a place to live. We need to handle it while we're in prison, which we're doing through our substance use facility plus our use of medication-assisted treatment, but we also need to make sure that there's someone there to direct them to the right place when they get out. We can't assume they'll know where to go or how to do it, and this program will make sure that they do. The task force report reflects a real commitment by this administration at every level to combat addiction. While funding is a necessary and significant component, our most important resources are the people that really care about this issue, the families who are suffering from this issue, the folks in recovery who are trying to get themselves back to a place where they can be a productive member of society. And I want to thank the Cabinet for recognizing that. And that every one of these programs is centered on how do we deal with people who have a problem, or how do we do the best we can to try to prevent that the problem happens from happening in the first place. It's for those individuals that we continue to develop new approaches to fighting this battle, those people. And it's for those individuals that will continue to use the power of this office to ensure the state's doing everything possible to support prevention, treatment, and recovery so that we can slow this epidemic and stop the pain and suffering that's going on in our state. So I want to introduce Charlie McKenna to make a few remarks. I'll come back and take questions. But I am really, really proud of what we're doing here, and I can tell you that a lot of these suggestions will be ones that I'll be recommending to my fellow commission members on the National Commission that I'm chairing for President Trump, because I think these are things that can be scaled on a national level, and that's a further tribute to Charlie and the members of the task force. I want to thank Charlie for taking on this role and the hard work he's done over the last 9 months on it. Introduce him for some remarks, and I'll come back for questions. Charlie, thank you.
Thank you, Governor. I want to echo some of the governor's comments and really thank the task force. This truly was a group effort, not only with the task force members, but with their staffs. And we had some spirited conversation, but it really was a group effort. I also want to thank people in the recovery arena, people like Diane Litterer and Mary Pat Angelini and Angelo Valenti, who gave of their time. Doctors, like the doctors at St. Joseph's Hospital, who really gave of their time. Nurses that came to talk to us. And all of the input that we had. And what we have here is really the sum total of all of their input. And again, the hard work of the task force members. And finally, I want to thank, there he is, the governor, for being such an incredibly strong voice in this. This is a huge problem nationally. And in order to turn the corner on that, we need somebody who is going to be a true advocate for that. You are. And I thank you for all of the work you've done.
Thanks, Charlie. Appreciate it. All right, questions?
What's here that you'd like to see made into legislation right away, since you want to get this done before you start?
I don't know that much of this, Sue, needs to be done legislatively. I think a lot of it we can do through executive action, and already doing a lot of it. We're sharing the report with the leaders of the legislature, and if there's things in the report that inspire them to come forward with legislation before we leave, we'd be happy to consider that legislation when it comes to the desk. But I think that what our focus was, given the amount of time we had left and the limited number of days that the legislature is going to be in session between now and January 16th, was to try to focus on things that we could do immediately as cabinet members and the executive branch to get this done. So there's nothing that pops immediately to mind legislatively, although some of these things that we're doing from a regulatory perspective, the legislature may like them enough that they want to put them in statute and make them permanent. More permanent than a regulation is. So we'd certainly be willing to consider that. And as I said, we're passing on the report today to the leaders of the legislature as well. And we're happy to talk to them when they get done from campaigning. Yeah.
Why was it, what is it about the Narcan and the limitation, of how many milligrams you had, and what kind of special steps did you have to get in order to get formalized?
Well, two milligrams just is not enough to reverse the overdose of most people who are overdosing from fentanyl.
So people have just died?
Correct. Okay. Correct. And so we've gotten this report back, the task force got this reports back from EMTs who were saying that, we knew someone was with fentanyl and we gave them 2 milligrams of Narcan and we couldn't reverse them. And we need 4, but they were not authorized by state regulation to carry 4.
So it's a state regulation you're changing?
Yes. And it's now going to make 4 milligram doses. And those are now available, too, in a nasal spray form from the company that manufactures Narcan. So literally, it's just 2 pushes, one in one nostril, one in the other. And that'll deliver 4 milligrams worth of naloxone, and that will reverse, if you catch it soon enough, even a fentanyl overdose. So, we were unnecessarily losing lives because EMTs were not fully equipped with the full dosage that they would need to deal with fentanyl. Now, granted, fentanyl is a relatively new problem. So, we're trying to keep pace with the stuff that people are dealing out there and using, and this is one of the ways we can do it.
Yeah, Governor, do any of these changes carry a cost?
If they do, they've already been accounted for in the $200 million. David?
From the beginning, Governor, you've talked a lot about reversing and confronting the stigma that goes along with this whole issue. Are we making progress in that regard? From some stories that we've done, it looks like we're starting to, because there was an incident where a woman lost her son and she used his obituary to talk about the fact that he was an addict and to try to get that word out.
I think that, David, you put your finger on the place where we're seeing it emerge the most clearly, and that's in obituaries. When you would see these obituaries previously, they would not mention that the person died from a drug overdose. They would be silent as the cause of death of a young person. And what we're seeing now is that families are willing to say in the obituaries how their son or daughter passed away. That's the beginning of some signs that people are understanding that communicating about this is really important. I can tell you from talking to Vanessa Vitolo, who has been in almost all of the TV ads that we've done, she has told me that the people coming up to her on the street who just recognize her from the ads, asking her where she got help, asking her how they could get their loved one help. I mean, that's what we're trying to do, is engender a conversation and have people not feel sensitive about going up to someone who they know is in recovery and saying, how do I get help? So it's going to be a long process, though. I will tell you, I had a conversation with a woman just this past weekend who said to me, I don't understand why you're spending all the time on this. She said, you're restricting people who are truly in pain from getting the help they need. And I've been told that if you're really in pain, you can't get addicted. And that the only reason... Well, I mean, it's so contrary to everything we know scientifically about this. But there's still that sense. And this woman was absolutely sincere. I said, you're stopping me from getting the pain medication I need. Well, I said to her, the only restriction is on the initial prescription. Once you go back to your doctor and you get recounseled and reauthorized, you can get whatever size prescription the doctor thinks is appropriate. Well, that's not what my doctor told me. My doctor told me that he can't give it to me anymore. I said, well, your doctor's not telling you the truth. I mean, so there's a lot of misinformation still out there that we have to combat. And so I think there is some progress being made, David, but it's small. And it's not nearly what we're going to need to try to get people to come out from the shadows to do what needs to be done on the issue. Phil?
And following up on that, how would you assess overall what impact on the problem, the steps that you've already taken, and what additional steps you want to take in resolving this review?
It's hard to measure. It's too early, I think, Phil. I mean, my guess is, and it's only a guess, but my guess is that we're going to see deaths go up the next couple of years rather than go down. I think we're on the wrong side of the curve here. We're just combating this at a time when it's just becoming exponentially more prevalent. And so I think that what we hope to see, what I'd hope to see from the efforts that we're putting in, is a slowing of the rate of increase in the next year or two, and then a decline after that. But that's going to take vigilance by the next administration to do the things that we've been doing, and maybe more, depending upon what new steps and treatment modalities and prevention strategies are available to them that we don't know about today. But I wouldn't say like, okay, we can really notice a difference. I think the most that we can say is that we have people talking about it, that we have people noticing it, and that we don't have people, with rare exception, arguing with our decision to invest in it. And so I think that's progress, but I don't think on the raw numbers, Phil, we're going to see a change in the near term. I just think this thing is going downhill quickly, and stopping it is going to take a long time and a lot of effort.
So just to clarify, in terms of scaling some of this nationally, are you looking at, are there specific items or?
Well, I'm submitting this to the rest of the commission members for them to look at. That's not my, it's not my sole decision. I have 5 other members on the commission who are going to consider all this stuff as well. We have a meeting October 20th, a week from Friday, in Washington to deal with the insurance issues and some others. And so we always have pre-meetings before that to talk about whatever anybody wants to see, either included in the questioning or included ultimately in the final report, which is due, I think, 3 weeks from today. So we're pretty deeply into writing the final report, and we're going to include these and see what commission members think about them. Remember, that's the good part of the way the president put this together was having 3 governors on there of both parties. You have people who bring the perspective of, here are some ideas, but can they really be implemented on the state level? Can they really be done? Having Professor Madras, who has the long history of this epidemic, its development, its growth from an epidemiological perspective, is great to have her on there to say, well, no, I don't think this will work because it was tried X time and it didn't work then. I don't think it'll work now. And then, having Attorney General Bondi gives us a different law enforcement perspective. Even though Governor Cooper and I were both law enforcement folks, having Pam is good on that. And Patrick Kennedy is important not only because of the work he did in Congress, but because he's an active recovering addict. And I can't tell you how many times Patrick brings something to our attention or a response to something that's put forward that speaks from somebody who's in recovery and has been in treatment. And that's really important. So I'm going to give this to them and let them decide with me what we want to put in.
Just to follow up,
Yeah.
is there anything in particular that you feel like you really are going to advocate for?
Well, certainly the Narcan being at 4 milligrams across the entire country is really an addendum to the interim report, which are going to say, we said it should be in the hands of every law enforcement officer in the country, federal, state, and local. We're now going to say 4 milligrams should be in the possession of all of them, because fentanyl is becoming such a problem. So that's one that jumps out right away. And I think others, there's none that I don't feel strongly about, but it's our report, and so I want to run it by the other men and women on the commission to make sure that it's just not pride of authorship, because it's our ideas. I like them the most. So I want to make sure that they pass the test with folks whose ideas, these ideas didn't originate with them. I want to make sure that they feel that it's important as I do.
Talked about the problem worsening. Do you think there's been a toll because the president has not declared a national emergency as you've suggested? I think he will before your task force expires at the federal level.
I believe so. And do I think that it's worsened because of that? I think the problem is too big to say that if he had declared an emergency 2 months ago, that it would make a significant difference in 2 months. But I would also say you can't get those 2 months back. And so it's not good that it hasn't been done yet. But I'm not going to say that. I can't say really, Sal, like, would 2 months have made a difference? All I know is 2 months is 2 months, and I would have loved to have had the time to have worked on it in that respect. But, they're telling me they've got legal issues and hurdles to get over that they haven't gotten over yet. I take them at their word. But if you're asking me would I have preferred him to sign it on August 1st, yeah, I would have. When it comes, it'll be welcome no matter what, and it'll make a difference.
Will your plan, as you envision it right now at the federal level, still work without that declaration?
I think it's lessened if we don't have it. I think there are aspects of it that will still work, some of the other recommendations, and some of the ones that we'll make in the November 1st report. But it is lessened without that call to arms for all the cabinet members. All the cabinet members here know that we declared this a public health crisis by executive order and an emergency, and they knew what that meant, and that's part of the task force's report is a reaction to that. The $200 million is sitting and saying we have to marshal resources from everywhere in this government to be able to put more money, to now put $500 million. Listen, we're spending in New Jersey this year what the federal government in total spent last year on dealing with this crisis. So, we're putting our actions where our rhetoric is on this, and I trust the White House will do the same. Yeah, Dustin.
Governor, are there any elements of that interim report, the recommendations that have been implemented or in the process of being implemented?
Have been implemented? No. In the process of being implemented? Yes.
Off the top of your head, do you know which ones?
I can't say, because then I'd be jumping their announcement of having implemented them, and if someone did that to me, I'd be unhappy, so I won't do it to them. But there are some that are in the process, but there are none, to the best of my knowledge, and I think my knowledge is pretty current, that have been implemented yet. No.
Well, when you released the report, you said these are things that could be done pretty much immediately.
Yes.
Is this another, like the declaration by the president, is this something you're concerned about, the missing 2 months essentially, maybe more?
Listen, I'll always be concerned about that, because I'm not concerned about this issue, Dustin, but I'm not going to let the perfect get in the way of the good. if we get these things done, then it's going to be good for the people of this country, and we need to get them done. And that's what I'm focused on. Sue?
On the medical examiner piece, there's, in the report reference that, you know, the state office has limited authority and that some offices, the county offices are understaffed or underfunded. Have you thought about, you know, I'm aware that in the legislature, there's been a bill to strengthen the state office of the medical examiner. It hasn't really gone anywhere. Is that something that you would support?
It's something I would consider depending upon how they did it. And the Attorney General and I would consider it. I think we both have walked away from this examination, along with Charlie, concerned about the state of our medical examiner offices across the state on this issue. And part of it, Sue, is because we can't get accurate data, right? You know, each different county office has different standards about what they call an overdose death. And so, you know, we don't know if there's overestimating in some places and underestimating in others. And so, you know, it may be that the next administration is going to have to consider, or this one in the lame duck, you know, a statewide standardization of the medical examiner offices. I would certainly be willing to consider that, because right now what's happening is, I think the state office is fairly well funded, but the county offices are generally underfunded, and I don't think people thought about the effect that would have on the opioid crisis and our ability to be able to determine exactly what was going on county by county, find hot spots, and then deal with those hot spots. And so certainly something I'd be willing to consider. I know about the bill that you're talking about that's pending. Yeah. And Senator Vitale and I have spoken about this. So, you know, he and I, as you know, have worked on a number of different things together, most recently Horizon. You know, we disagree on some other things too. So I don't know that we could definitely come to an agreement, but Joe and I have always been able to figure out a way in almost every instance, except for the executive reorg, to be on the same side of things. So hopefully we can figure it out in lame duck to do it, because I think it'd be something important to do. Yeah.
Off-topic question, if you don't mind, but do you have any advice for Phil Murphy ahead of tonight's debate?
No. I think that gubernatorial debates are unique experiences for the people who participate in them. And I'm confident that the lieutenant governor will be ready, because she's gone through 2 statewide debates before, in 2009 and 2013, and then she had her debates in the primary as well with Assemblyman Chitterelli. For Mr. Murphy, this will be a relatively new experience, except for the experience he had, you know, in the Democratic primary debates. But this is different. Democratic primary debates, you're mostly agreeing with each other and then finding ways to insult each other, so that you could show that you're different. In these debates, there'll be real differences, substantive differences between the 2 candidates. And so, you know, I don't have any particular advice for Mr. Murphy, and given the tenor of his campaign, I don't know that he really wants advice from me. So I only one choice, so I don't know if I know all that much about this. David?
Some of us who cover these campaigns have noted that Kim Guadagno's most articulate surrogate is the governor. Yet he has not appeared in any campaign ads, no events. Are you either raising money for, planning to campaign for, or appear in any ads for Lieutenant Governor Guadagno? Okay, raising money for, yes. I've raised over $2 million now for the RGA. And I think you see the fruits of some of that labor in some of the advertisement that's going on by the RGA in the state. Appearing in ads or campaigning for, I've said this right from the beginning, that's up to Lieutenant Governor. If Lieutenant Governor asks me to campaign for her, I will campaign for her. If she asks me to appear in an ad, I'd appear in an ad. But those are her decisions. It's her campaign. And I appreciate the fact that some consider me an articulate spokesman on her behalf. And I'll continue to do that because I believe in her and I believe in her positions in the main on the issues. I certainly believe in her positions more than I believe in Ambassador Murphy's. But you know, I'm not injecting myself into this campaign without the invitation of the candidate. It's the candidate who gets to make these judgments, and I respect that. That's the way it was when I was a candidate twice. I made the decisions about, you know, who made ads on our behalf. You know, I was happy to have Shaquille O'Neal do an ad for me. That was a decision I made. You know, there were some others that were, you know, good endorsements and good support. In fact, you know, in preparation for tonight's debate, I actually went back and looked at our ads in 2013. I hadn't done that for a long time. I'm happy with them. I think they wear pretty well, and they'd wear pretty well today, too. Yeah, David.
Are you concerned at all, Governor, that all of the efforts that you've made in this arena may not be followed through completely depending on who wins in November? And would you consider talking to the eventual winner of the gubernatorial race to try to cement, you know, the progress that's been made and the direction that you've taken the state in on these issues?
Well, David, I intend to have a lot of conversations with whoever wins in November. I'm not going to run a transition like John Corzine ran. I mean, John Corzine and I had 2 conversations from election night to inauguration day. And quite frankly, I think I was lesser for it and the state was lesser for it. I intend to make myself as available as possible to either Lieutenant Governor Guadagno or Ambassador Murphy to try to not cement things that I've done, but to try to tell them what to expect. You know, whatever you think when you're running for governor, when you ultimately become governor, it is significantly different. Right from, you know, picking a cabinet and a senior staff, it's a lot harder than people think it's going to be. We grossly underpay these people, and it is really hard. It's one of the things that I'm most disappointed about with the legislation that didn't pass back almost a year ago now. We should have increased cabinet salaries. It is almost impossible to, over the long term, recruit people who have not been career government employees to come into these jobs. So there's all kinds of things that they have to be ready for that, you know, they may not be thinking about right now. And so I intend to talk to them about a lot of things. I'll certainly talk to them about the opioid issue. But the bottom line is I don't think there's anybody who would be running for governor of New Jersey who would not understand that this is a really important issue to the people of the state. And that if they do back off of what we've done, that there'll be a political price to pay for that. Because this is affecting families of every demographic in every county of every political party. And so you don't find many issues like that, David. And when you do, you better address them. Because if you don't, it'll be part of the reason that you're shown the door after 4 years. So I don't worry about that too much. What I worry about in the transition is, as I mentioned a week or so ago, I had a cabinet meeting where I told all the cabinet members, transition memos are to be done on election day. You are to be ready with that on election day so that whenever the winner names your successor, that you can hand that memo over to them at a personal meeting that I want you to have with your designated successor. Well, if I'm telling them to do that, you know, I'm going to do it myself and make sure that I'm available to that person and be able to give them advice, some of which will be solicited and some of which will be unsolicited. But when you're governor, you get the right to give unsolicited advice too. So that's the way we're going to run this transition and try to make it as effective for the people of New Jersey by making it as, you know, informative as we can for the governor-elect.
Back to Sal's questions. You had mentioned that there were some legal issues that are being worked through right now. I mean, is it in regards to the specific language or
I've not gotten into that at all with them. It's not my job. I made the recommendation. I'm not the drug czar. I'm not the White House counsel, and I'm not the Attorney General of the United States. So, like, it's not my job to do that. And quite frankly, I haven't gotten involved in it. All they've told me is they're legal issues. And I didn't say, hey, I'm a lawyer. Let me look into it. You know, it's not my job. So that's what I've been told. That's the extent of my knowledge on it.
And are you aware of, in the past, of a president saying, I'm going to make a declaration, and then there being such a long lag? I mean, is this the longest?
This is a very unusual situation. I don't know if it's the longest or not. You'd have to look that up yourself. I don't know. But this is an unusual situation. Most emergency declarations are for a natural disaster in the past. And so there's not a real need for a big gap, and it's not an unusual legal question. This is, because there's not a certain end to this crisis. A storm, there's a certain end to the immediate crisis, and then you have rebuilding and recovery. This could be years. And so I understand some of the nuance here is a little bit unusual and difficult, but I can't imagine that it's insurmountable. Sal.
Are you looking forward to watching the debate? It seems like you've been a boogeyman at the primary debates and some of these TV ads over the course of the campaign.
Not particularly. I mean, to be honest with you, like I I set it up to be TiVo'd tonight, so that if I don't, because I don't often get home from here by 7 o'clock, because it's about an hour and 20 minutes to get back to Mendham from here. So that means I got to be out of here at 5:30 or so. So I'm not usually out of here at 5:30. So I may not make it in time for the beginning. So I set the TiVo last night. So I'm all squared away there. The DVR is set. And so if I miss the beginning of it, I'll be able to watch it after I eat dinner or something. But no, it's not like I'm sitting around like popping popcorn, can't wait. I mean, these things are like, if you're in them, they consume you, and you'll be able to tell from the ratings tonight. If you're not, they don't. So, I'm interested, but, this isn't my race.
So you don't think it'll get good ratings?
I know it won't. None of mine did. I mean, I can't imagine these will. I mean, I don't think gubernatorial debates generally get good ratings. I mean, there'll be a small committed band of people, most of whom already have their mind made up, who will watch it. And then it's what you say about it tomorrow, which is what most people will learn of the debates. Be what you say, I say online and in the newspapers and on TV and the radio. That's what people will know predominantly about the debates. Not a lot of people watch it. That's not breaking new ground here. That's just the fact. It's the after coverage, which is why most debates are defined by who makes a mistake, because you guys will write a lot about a mistake or a gaffe or an insult or something like that, and then that's what people will remember from it, not the 3-point plan on this issue and the 5-point plan on that issue, and did they directly answer this question or that question? That's not what you guys cover. You guys wait for the moment. And the moment can be different things at different times. Like someone can be a really good, uplifting thing that somebody does, but more times than not, it's somebody screws something up, or there's an insult or a good, cutting, comment that's made, and people go ooh and ah in the audience, and, and then that's what gets written about. So my suspicion is that if you polled it afterwards, what most people would remember is whatever you guys wind up writing and saying about it afterwards, not necessarily what they saw in the individual debate. But, I'm not anxious. I mean, I'll watch, but not like if the Mets were playing tonight. No, I'd watch the Mets and TiVo the other thing and watch that at 11 o'clock. Well, I don't think it says anything more than I'm a big Mets fan, and I've got it wouldn't matter. It doesn't matter who's running. If you're not involved in it in some specific way, you're not going to be as invested in the debate. I'm invested in the election. I'm very invested in who wins or loses, and I'm going to be there voting. And as you said earlier, I'm certainly advocating for positions and people that I feel strongly about. But fact is, I was very involved in the Trump debates because I was in charge of debate prep. So then you're really in it because you want to see, did I help or not?
Did you not involve yourself in debate prep with your lieutenant?
I have not been asked. So the answer is no.
You would watch the 70 and 92 Mets?
No. If the Mets were playing tonight, they'd be in the playoffs.
Okay.
No. If it were the 70, if this was back in September, no, I wouldn't have watched the 70 and 92 Mets. But if the Mets were playing tonight, David, they would be in the NLDS, and then I would definitely watch that. And if it were in New York, I would be at the game. But no. The 70 and 92 Mets, no. I'm not even that much of a masochist. No, I wouldn't do that. Yeah, Phil.
Do you have some priorities you'd like to share about what you'd like to see enacted in lame duck?
What would I like to see enacted in lame duck? The interest arbitration cap. I'd like to see us make sure that we clean up anything that needs to be cleaned up from a budgetary perspective, whatever we know from the first half of the year or so. So if there's any kind of supplemental changes that we need to make sure that we make those so that we leave it as clean as we possibly can for the governor-elect. But other than that, not a whole lot. Nominations, I'd like to get some nominations done, particularly in the judgeship area, make sure that we, fill as many of those judicial seats as we can so that people are not having a big delay in terms of getting justice. I will tell you that the Chief Justice has told me there are more judges seated now than at any time in his time in service on the court, and even beyond that. So we've done a very good job along with the Senate, despite the fact that we had a lot of disputes over it along the way. We've gotten a lot done, and I'd like to finish that job. But that's all going to be up to the Senate to decide whether they want to get involved in that or they don't. and we'll wait to see the results of the election, who the Senate president is, and, what they want to do.
And on the interest arb and the budgetary matters, you would need the Assembly to act as well, given the current state of your relations or non-relations with the Speaker. How difficult might it be to get this done?
Well, first off, I would hope that the Speaker would, as I do every day, put his own personal feelings aside for the betterment of the state, and certainly mayors and county execs and freeholders from all across the state of both parties have said they want the interest arb cap done. So I would hope that the Speaker wouldn't put any kind of selfish, feelings that he has personally regarding me in the way of doing something that was that important for the people of the state, and that the interest arb task force report has proven has been so effective, saving $530 million in additional firefighter and police salaries, and along with the property tax cap, $2.9 billion in taxes that would have been increased without the cap. Those are things that are tangible accomplishments that I would hope the Speaker wouldn't stand in the way of. And secondly, there's a vote for a new Speaker like 2 or 3 days after the election. So I wouldn't assume who the Speaker is going to be for the lame duck. David?
Should New Jersey voters be influenced by, pay attention to the fact that Phil Murphy took money from and maybe met with Harvey Weinstein?
Well, I understand that the ambassador has a lot to say about it today. I mean, I think any of us in public life, need to be held accountable for who we accept money from. Do I think it should determine your vote? No. I think it's just another factor to influence, and each person will decide how important that is to them. But do I think that's a determining factor for anybody? No. But he seems to be reacting fairly sensitively to it today, so he must be upset about it. But listen, everybody, that's kind of the way it goes. You take money from famous people in Hollywood, and they go astray. You got to be held to account for it. I mean, I have found it incredibly interesting, though, about except for like the New York Post, like the relative lack of coverage of it, in the Times and the Post. Other than that, I mean, I can only imagine if that were, a Republican donor, if that was like one of the Koch brothers. Can you imagine if that was like David Koch? Can you imagine what Saturday Night Live would have looked like if that was David Koch? Can you imagine what the cable news coverage would have been if that was David Koch? I mean, this is another example of how there is a liberal bias in the media, and to have Warren Michaels say, well, it's just a New York thing. That's why we didn't do anything, and they actually cut something from Saturday Night Live about it. Come on. Harvey Weinstein's just a New York thing? I mean, Harvey Weinstein's as big in Hollywood as he is in New York City, and internationally is a huge name. Why all of a sudden the reluctance? Why did it take Hillary Clinton this long? Man, everything that, a Republican does, Hillary Clinton's like on her, Twitter feed or has her spokesman saying something really quickly, and it took her how many days? So she finally put out that statement today. Still haven't heard anything from President Clinton, haven't heard anything from President Obama, haven't heard anything from Mrs. Obama. They actually had their daughter intern there. I mean, that's stuff that should be talked about by leaders. So I give Ambassador Murphy credit for at least talking about it today, and I guess he said everybody should give back all the money. Okay, it's a position. But I'm confident. I thought I read about, earlier in the campaign about reports of him meeting with Harvey Weinstein and Robert De Niro and a number of other folks down in Tribeca about his campaign and about fundraising for his campaign. So it was okay then, but it's not okay now. I guess that's his position. Only thing I would tell you is, boy, it definitely gives you a cautionary tale about being his friend, huh? When the storm comes in, baby, don't look for him to point you to the storm cellar, because he will already be in there and have the door locked. So, I wouldn't be too optimistic if you're a FOP. Yeah.
I was just wondering if you switched teams, I see you got on the Eagles screen.
Yeah, no. Although after the loss on Sunday, that took me about 4 or 5 hours to get over to watch Aaron Rodgers do it to us again. And as for the Eagles, no, the green is just the one I picked off the tie rack today. So no subliminal messages being sent to Eagles fans at all. And if I did, I don't think they probably appreciate it all that much anyway. So no. But still, I'm over the Cowboys game now, but it took me a good 4 or 5 hours to get over it. Any other questions? All right, I want to thank David.
Have you figured out a job yet?
Huh?
Have you figured out a job yet?
No, I haven't, David.
Interviewed for anything?
Have not interviewed for anything, no. It's a tricky thing. Now, it's reported erroneously most of the time. There's this kind of like blanket reporting. I think Dustin does this the most, where he says, Christie is not permitted to interview or consider any offers under state law. That's just not true. I am permitted to do that under the appropriate circumstances, and I have a clear idea about what I'm allowed to do and what I'm not allowed to do. And by the way, the rules that they talk about are rules that apply to cabinet members and senior staff. And if they were as strict as Dustin makes them out to be in his stories, then none of them would be able to get a job until they left. We know that's not been true over the course of the last 30 years of people who line up jobs before they leave and then leave. But no, I haven't interviewed for anything. I don't have any offers currently pending, and I'm not particularly concerned about it. Mary Pat's told me I got 2 weeks. She said if I'm still in the house all day come February 1st, we're going to have a talk. So I got 2 weeks to get it together and get a job. But I feel relatively confident that someone will want to give me something to do when I leave here. And so I'm not all that worked up about it yet.
Could you clarify what the restrictions are?
We can have counsel's office send it to you because I'll just hack it up if I repeat it here. So we'll have counsel's office tell you what I can do and what I can't do. But to let you know, there is no blanket prohibition against me doing this. In the same way that, I don't think the Drew University presidency came by, immaculate conception to Governor Kane when he was leaving, and he had that lined up and went right to it. So there are things you can do to be able to pursue opportunities, and I've certainly consulted with counsel's office about that and made sure that, I remember too, there's different ethics codes that apply to the governor versus apply to other members of the executive branch. That's always been the case. At least in recent times, since Governor McGreevy's time, I believe. So, you can certainly reach out to DiGiulio, and he'll be able to fill you in on what he wants to fill you in on regarding what I can do and what I can't do. But all that having been said, I haven't done anything. So, I clearly have not yet violated any ethics laws because I haven't done anything. So that may be disconcerting to my wife, but for the rest of you, I'm sure it serves as a real moment of relief that you don't have to worry about that. Anything else? All right. Thanks to Charlie, the Attorney General, all the other members of the Cabinet who are here. Appreciate your hard work on this. We have a lot of work still to do. RFPs are going out. The things are in motion to be able to put this money to work for the people who need it in this state and for the families that need it in this state. So we're excited about that, and I appreciate the hard work that Charlie and the entire task force put in and all the people that consulted with them. So thank you all. Enjoy the evening. I will as well. Have a good one.